Assalamu alaikum. As we have studied the developmental structures of the teeth, now we will study the developmental anomalies or the developmental abnormalities of the teeth, which is the first chapter of oral pathology. We will cover it in two videos because it's lengthy. So, starting Bismillah Rahman Rahim, classification of dental abnormalities on the basis of there may be size abnormality, there may be shape abnormality, there may be number abnormality, or there may be abnormality in the structure, or their eruption pattern may be abnormal. So we will study the size abnormality, shape abnormality, and number abnormality in this lecture. Let's continue. Abnormality in the size may be microdontia or macrodontia. Now, what is macrodontia? What is macrodontia? Let's study. Macrodontia is a type of dental anomaly or dental abnormality in which the teeth are smaller in size than normal. The cause of macrodontia is decreased growth hormone, which is also known as the dwarfism. I cannot write it proper, but it is dwarfism. There may be Down syndrome or congenital heart disease, or it may be due to the genetic hereditary problems. There may be cleft lip of palate or any radiotherapy provided to the patient, or especially during pregnancy, or there may be congenital syphilis or supernumerary teeth, or macrodontia also sometimes be the reason of wear and tear or erosion, or with the age due to the use of the teeth. There is macrodontia. The types of macrodontia is true generalized, relative generalized, or local focal. True generalized means that whole of the teeth in the mouth are in smaller size, or it may be it usually is due to the decreased growth hormone or hypopituitarism. And relative generalized means that the jaw size is so much large that the teeth in the jaw appear smaller. So the jaw size is larger, and the teeth are normal. These are normal teeth, but the jaw is larger. And local or focal, it happens mostly in the maxillary lateral incisor. There is cone-shaped appearance of teeth which is called peg lateral. The most common involved teeth in the microdontia are the maxillary lateral incisor, as we studied, which is also called peg lateral, and the third molar. After these teeth, the maxillary and mandibular second premolar are more common. Treatment is usually cosmetic treatment, which is crown and bridge. Macrodontia is a state of abnormally large teeth. As we studied in macrodontia, there were the teeth which are smaller, but now macrodontia is a name of disease in which the teeth are abnormally large. The causes of macrodontia are pituitary gigantism. We studied there that there is hypopituitarism, low level of pituitary secretions, but here it is pituitary gigantism. There may be fusion or facial hemihypertrophy. The types are same as before: true generalized, relative generalized, or local focal. So the true generalized is actually the in which the whole of the teeth in the mouth are abnormally large. The relative generalized is the same as before, but here the jaw size is smaller. Jaw size is smaller, and the teeth are normal. Teeth are normal. So it appears as if the jaw teeth are very large, but no, there is a decrease in the jaw size. There, and the local focal, which is localized to some teeth. And remember it, don't confuse it with the fusion. We will discuss fusion in the coming slides, inshallah. Abnormalities in the shape may be gemination, fusion, concrescence, dilaceration, talon cusp, dens invaginatus, dens evaginatus, tarodontism. Let's discuss it one by one. Gemination is a word derived from Gemini, which is a zodiac sign, and it means twins. So gemination refers to a developmental irregularity in which a single tooth germ divides, resulting in a bifid crown on a single root. That is, two teeth develop together from a single tooth bud. Gemination is characterized by partial division or twinning of a single tooth germ in which the tooth count is normal and have one root canal. Gemination, it is gemination, not germination. Tooth gemination mostly occur in anterior teeth, mostly incisors. The prevalence rate is in the primary teeth it is 0.5%, in the permanent teeth 0.1%, and in both dentitions 0.02%. Fusion. Fusion is actually the union between two or more separate developing teeth. In the fusion, there is one teeth, two teeth. These teeth fuse together in such a way that it give rise to a single tooth. Single tooth, but such anomaly may be complete or incomplete depending on the developmental stage of the associated tooth buds. If contact between the two tooth buds occur before calcification, complete fusion ensues. This may be seen clinically as an abnormally wide crown, usually with the groove that separates the mesial and distal. And if contact occurs after crown formation, incomplete fusion occurs at the root level. Incomplete fused teeth may be present with the separate pulp chambers and separate canal. It has separate root canal. Tooth count is decreased, as we said that this is one teeth and this is two teeth. But if it fuses, it results in a teeth which we count it as one. So the tooth count number is decreased. And tooth gemination mostly occur in anterior teeth, which is incisors. And the prevalence rate is same as you can see primary teeth it is 0.5%, permanent 0.1%, both dentitions 0.02%. So studying the treatment, usually the fusion is not treated, but although the fused teeth may not bring about any clinical problems, treatment is needed when these anomalies cause caries, periodontal disease, crowding, or aesthetic impairments. Surgical endodontic, orthodontic, and restorative interventions are usually proposed to manage fused teeth. Concrescence, fusion of two or more teeth by deposition of cementum following completion of root formation. So after the root formation is completed, the two or more teeth fuse together in such a way that they result in a cementum formation. This disease is mostly related to the hypercementosis. The most commonly involved teeth are the upper second and third molars. Studying the causes of concussions, the condition arises as a result of traumatic injury or overcrowding of the teeth. There may be true concussions or acquired concussions. True concussions occurs during root formation phase, whereas acquired concussions occurs after the radicular phase of development is completed. Treatment: if the condition is not affecting the patient, no treatment is needed. Concussions teeth could be reshaped and replaced with full crowns. However, if the teeth are having recurrent problems or non-restorable or some pain, extraction should be considered. Dilaceration is defined as deviation or bend in the linear relationship of a tooth crown to its root. You can see the tooth crown to its root normal relation should be straight, but it is disturbed or deviated or bent from the normal relationship. So what are the reasons of dilaceration? It may occur as you know that the permanent teeth are still in the jaw while the deciduous teeth are already erupting due to traumatic injury to the primary teeth, which pushes the permanent teeth apically, resulting in a bend in the root. Root formation also occurs during curved path of eruption. Remember, in dilaceration, the tooth is hook-shaped, and in X-ray it is visible. It is prone to fracture during extraction, and it frequently affects the maxillary incisors. Remember it. Talon cusp. It is you have seen an eagle talon, which claw-like structure. Talon cusp is a dental anomaly in which eagle talon projection, as I said, like cusp of hard tissue protrudes from the cingulum area of the maxillary or mandibular anterior teeth, which is mostly found in the maxillary lateral incisors. It is a manifestation of dense evaginatus. We will study in the following slides, in which tooth-like structures arise from the normal teeth. You can see here in the image. Let's zoom in so you can notice the change. It contains enamel and dentine. It is associated with the Robinson-Tabby syndrome, which is a rare genetic condition characterized by short stature, moderate to severe learning difficulties, and distinctive facial features. And remember this: there is a broad thumbs and first toe, and the fifth finger is bent, which is also called clinodactyl. It is caused by the mutation or deletion in the CREBP gene and EP300 gene. It is located on the chromosome number 16. Talon cusp, remember three T's. The T-shaped projection, there is talon cusp eagle, and this there is Tabby syndrome association.